How many patients have you seen that come from paddle?
If the patient doesn't need surgery, I believe it's a crime.
So as much as we work out lifting weights, we have to focus on the flexibility and mobility.
You want to kick yourself. Why did I say yes to this patient?
What type of tools do you guys use, especially with the advancement of technology?
The beautiful thing is during the World Cup, that patient became a journalist. And he came and he interviewed me in Aspetar.
Welcome to the Late Night Podcast by Q+. Tonight's guest, he's an orthopedic spine surgeon. He's usually wearing scrubs and a face mask. But tonight, he won't be needing any of those. Dr. Abdulaziz Al Kuwari, it's a pleasure to have you on the podcast.
The pleasure is mine. Thank you very much for having me.
And thank you for joining us.
Thank you.
I want to go into it. So you're an orthopedic spine surgeon.
Yes.
Why did you choose this field?
Orthopedic is a beautiful specialty. Initially, I wanted to do plastic surgery and actually joined general surgery program in order to become a plastic surgeon. But when I did my orthopedic residency, when I did my orthopedic rotation, I fell in love with the reconstructive part of orthopedic. And then I fell in love with spine because I thought it's a very challenging specialty. And also another reason that have pushed me toward this field is the need, as there was no Qatari orthopedic spine surgeon. So I became actually the first Qatari orthopedic spine surgeon, and I'm still the only one.
So you saw it as a niche in the market?
Exactly, a niche and a need. Yeah. Anybody who's patriotic about Qatar and about his country, he will work hard and try to choose a specialty that is really badly needed in the community. And spine was really badly needed, so that's why I chose it.
And I want to know more about your journey to becoming an orthopedic spine surgeon. So let's go back.
Okay, it's a long journey. It started actually before that by going into medicine. And I have to say that I chose initially medicine because I wanted to do plastic surgery. So I went to Ireland actually to 1998 and after graduating from the high school here and scoring high to get a scholarship, when I went to Ireland I discovered that I have to do the high school there again in order to get a position or a seat in the Royal College of Surgeons because the competition was high. We have limited international seats. And alhamdulillah Rabbil Alameen, I was able to succeed and I got into the Royal College of Surgeons. 6 years later, 7 years total in Ireland, I graduated 2005. I did my internship here in Hamad Medical Corporation. Then I joined the orthopedic surgery program. 5 years later, I finished the orthopedic. I became an orthopedic surgeon and I chose, as I said, spine surgery to be my subspecialty. Back then we didn't really have a strong fellowship program, so I had to travel again to do the fellowship in London, Ontario, University of Western Ontario. I worked with actually 4 spine surgeons, so I was almost operating every day, 4 days a week surgery and one week clinic. And this is the beauty of doing a fellowship. You work in a high volume center, you get exposed to a large volume of cases and in a short period you learn so much. And also I did masters in spine biomechanics. After that I came back and started working as an orthopedic spine surgeon. 4 years later or within my journey I was appointed as the CEO of Aspetar, which is a sports medicine hospital. And I also kept on going with my surgical career. You would ask me why, because first of all,
it's something you'd love to do.
I'm really passionate about surgery and I really enjoy surgery. And also the need in Qatar for an orthopedic spine surgeon. And alhamdulillah, it was supported by the higher management of Aspetar. and I continued to operate 1 day a week in Hamad Hospital. Recently, 6 months ago, I actually moved to my private practice in Al Ahli Hospital, and it's challenging to maintain, like to work in 2 positions, but the reward that you get by the appreciation and the prayers you get from your patients,
It's worth it.
it's really worth it. So it's like I have 2 lives,
To balance between them.
Yeah, the administrative life of Aspetar and the clinical. There is a lot of.
But don't you think choosing the administrative life in Aspetar is way easier?
I would say definitely it would be much easier for me, but I think I would lose a lot. For me, I spent so much of my time to learn the skills that I have learned. It will be a big loss for me and big loss for Qatar if I stop. That's why I fight to continue. It's not easy. It's very challenging. I work long hours because my clinic starts, usually I have 2 evening clinics, and I operate on Saturdays, so it is a tough life, but I enjoy it.
So Dr. Abdulaziz, how do you balance between your personal life and your life as an orthopedic surgeon?
It's not easy, I have my orthopedic surgery life, I have my admin life, I have my personal life, and I have my hobbies. I would say my life is not easy, but I think if you have good time management, you can enjoy your life, and you give each aspect of your life the time it deserves.
Being a CEO in Aspetar, do you think this gave you an advantage in an administration aspect?
I think being a physician and also being a senior administrative in Aspetar definitely gave me an advantage. As you know, some people believe that doctors should not be physicians, should not be admin, and administration takes a special skill set. But during our life, we do manage a lot of things, as physicians. We manage our team, we manage the residents, we manage our patients. And those set of skills can be employed in the senior administrative roles. And also, I would tell you something. When any request I receive from my staff, I understand every aspect of it because I am there on the field. I have my clinic in Aspetar. I see patients every day. If the physicians, they struggle with something, I struggle. If the patients, they're not happy with something, I see it with my own eyes. So I can,
So you were in their shoes?
Yeah, I'm fighting on the battlefield. I'm the commander at the same time. I'm fighting in the battle, so I can fix and understand all the issues and all the challenges that my staff go through.
So you're a foot soldier and at the same time a commander.
Yes.
And so you know what the issues they're facing.
Exactly. And if I struggle the same way they struggle, it give me, and I'm the CEO, it would be easier for me to fix. I use my power to improve the life of my soldiers, you can say.
Usually we have this concept of doctors, or when you have guys on the field, they're not eligible to be an administrator or have the role of a CEO.
Many CEOs, they have continued doing what they love. I can give you many examples in other specialties, like Yusuf Saif, NBN Sports. He became a senior manager. At the same time, he continued doing the documentary on the TV. It's one of the best. So why not he can continue?
And Dr. Abdulaziz, throughout your journey to becoming a CEO in Aspetar and a surgeon in Al Ahli, do you have any mentors?
Definitely.
Throughout your journey?
Definitely. In my life, I had many mentors. I can mention a lot of names, but without those mentors, you wouldn't be where you are. And sometimes, and Allah puts people in your way to direct you toward a certain direction. So I'm very thankful for my mentors. I have a lot of mentors that helped me when I was a junior resident, when I graduated and finished my board, even when I traveled in Canada. And I believe each time we travel somewhere, it changes something inside you. Like the 7 years I spent in Ireland shaped my character somehow. When I spent 2.5 years in the snow in Canada, again, meeting different people, learning from different cultures, it shaped your personality, it shapes your character.
And your perspective.
Yeah, it changes the way you look at the world.
We want to go to the surgery room now.
Yes.
And I want to know what happens inside. Could you recall your first orthopedic surgery?
It's a difficult question. I can definitely recall my first general surgery, because I was a general surgeon. It was actually an appendectomy, and I remember I was so excited.
So you said, what's the terminology?
Appendectomy. So it's an inflammation of the appendix, and which is part of the intestine, and you have to remove it. It's a small procedure, relatively simple, but the amount of excitement and the amount of I don't want to say fun, it's not proper, like you're enjoying but it's actually true, and we do enjoy our work.
Well, how did you feel finishing the surgery and leaving the surgery room?
You feel so proud and so happy that especially next day when you see the patient and he thanks you and he prays for you. There's no feeling that is worth that feeling.
I've even said this before. It's funny enough, even you as doctors, you see it as a first-hand, how the body adapts. So one day, your patient is under
Very
surgery,
sick, yeah.
And then the next day, the body is adapting and changing. It's nice to see how the body tends to adapt.
Yeah.
And
the beauty of surgery is you see your results instantaneously. Not all surgeries, but most. Whereas if you're a physician, you have to wait for your results. You give the patient either medication or, physiotherapy. You try to change his life. So the results sometimes take long. But for surgery, it's instant results. The patient has a lumbar disc. He's in severe pain. He's crying. He has some weakness. You take out the disc, and then everything is back to normal.
So physiotherapy is one of the options.
Well, definitely. You have to take every case by stepwise progression. The management always starts with pain management and physiotherapy before deciding to surgery. Obviously, there are certain indications that you will go directly to surgery if the patient, for instance, has weakness or paralysis. Then you can't wait.
It has to be like a surgical intervention.
You have to operate because you have to save the nerves before the permanent damage happens. You have to study each case, and always you should try your best to avoid surgery. Surgery is fun and we enjoy it, but it's not without complications. So the complications are rare, but they are there. So if the patient doesn't need surgery, I believe it's a crime to offer it even to the patient.
So what you do is they could offer physiotherapy?
Yes, always you have to exhaust the non-operative measures before moving to the surgical option.
And then you can decide if
yeah, and if you fail managing the pain, or the patients can't tolerate, or you're running out of options, then you have the option of surgery. And surgery is a good option when it's indicated.
And do you think our lifestyle plays a role in back injuries?
Definitely. There's something in surgery called patient selection. So if I have a patient like you, I'll be very happy and very motivated to operate.
Why?
Because you're physically active.
Okay.
You're strong. You're healthy.
So it makes me easy to do physiotherapy after that.
Not only that, your recovery is much faster. Your motivation is stronger. Even the people who do sport, their mentality is different.
They can endure pain. Maybe.
You can not about pain only, but the motivation is different. When somebody who's not performing sport, he's obese, his muscle mass is not strong. For us in orthopedic, it's a problem, and we know that it can definitely impact the outcome of surgery. There are surgeons who refuse to operate on obese patients because of, they know that the results will not be as promising as if you operate on a healthy and strong individual.
So it's not easy. So as much as the patient chooses the doctor, even the doctor chooses the patient.
Sometimes, yeah. Sometimes you have to know your limitation. If a patient morbidly obese, even the instruments that you use sometimes can't reach so that you could do your job properly. And there are different options, you know, for...
And do you recall any moments when the surgery was so severe that you had to think twice before...
there's no point in thinking twice, but you feel you want to kick yourself. Why did I say yes to this patient? It happens many times. I remember when I first started working, I said I will not be a cowboy, I will not do any challenging cases the first year. But then I start to see some patients that nobody else was agreeing to operate. Either sometimes they're obese, or sometimes for the complexity of the cases. So I had to step in and help those patients. Alhamdulillah, Allah helped me, and they recovered. But definitely, I did some difficult, complex cases that sometimes in the middle of the surgery, you say, I wish I had not.
You started
I wish I had not opened. I have not started. But when you have good intention, you know, and you really want to help the patient.
What was the most rewarding spine surgery you've ever done?
I think
the most story of something that happened.
Yeah, I think the most rewarding is the most challenging case which I did, which was actually it's called a kyphectomy, which is excision of some lumbar vertebrae. I had a patient who was paralyzed since birth. He's wheelchair bound, but he developed something called kyphosis, which is a spinal deformity, and his spine started to twist and protrude. It's like he had a bony prominence in his
when
back.
you have a hunchback, like
yes,
you're hunched a bit.
Hunched, but this was an extreme hunch that even he started to develop ulcers. He can't sit because of the bony prominences. So when this happens, you have to excise that bony prominence and fuse the spine in a certain way that make him straight. And in doing so, we had to remove, I remember, 3 vertebrae of the spine, which was a very challenging case for a 13-year-old kid. The beautiful thing is during the World Cup, that patient became a journalist, and he came and he interviewed me in Aspetar about our work during the World Cup. So, you know, the reward you get from seeing those patients is...
But don't you think like removing a vertebrate, like at the... Because how many vertebrates we have in the spine?
You're saying that I did the wrong procedure?
No, what I'm saying is like if you remove some vertebrates...
Yes, the patient will become shorter.
Maybe, yeah, but I think there's a space, like how does it happen?
Yeah, you actually
for you it's like basic
space,
language,
no,
for us it's
but I'll tell you, the space is already lost because of if you imagine this is the spine, and his spine became like this. Compressed, yeah. Like the whole spine is compressed. So what we did is we excised that vertebra, which was fused already, and I mean he already lost the function, and it was really giving him a miserable quality of life because he can't sit.
And I heard about like these back pains. The pain is not about the spine; it's more about the nervous system puncturing a spine or.
Yeah, the spine is a very complex structure. You know, you can have actually nerve pain due to compression of the spinal elements, and sometimes there is no compression of the spinal elements, and you still have spine compression. A simple thing like a muscle spasm can give symptoms of like disc.
You get this electric feeling.
Yeah. Why? Because the nerves, they run in the muscles. And if the muscles are tight, like you did a severe exercise and the muscle is really responding and tense, it gives a sensation like similar to the disc prolapse. So that's why you have to really carefully study your patient, examine him, listen to him, do all the required investigations before giving the answer to your patient.
You keep hearing about the most common spine injury, which is disc, and then hear like
lumbar disc. It's very common, yes.
Why? Is it the lifestyle?
There's many factors for
or is it like just vulnerable?
Lifestyle is a factor. genetic predisposition, like how our bodies is made. Sometimes there is weakness in the disc from the posterior part that allows the disc material inside to migrate and cause pressure over neural limits.
Is it like a gel type?
Yes, it's like a gel, and it shoots. It comes like there is an opening in that disc, and it shoots, gives an extreme pain to the patient. And luckily, you will be happy to know that 90% of patients with disc disease, they don't need surgery. They can be managed with pain medication, physiotherapy. Within 6 weeks, most of them, they will improve.
And does working out help you?
Obviously, it will help you because your body will recover faster and easier if you're an athletic. That's why I always say, if you're doing weightlifting, don't increase your weight dramatically. It's like some patients or some athletes, they have a huge muscular mass that's compressing the spine. And they forget to train the core and the back muscles, which is extremely important to support the spine. You have to have a balanced life, a healthy lifestyle. Flexibility is very important. It can help protect the spine, because even after the injury, you have to do sports for life. Because if you stop, the problems will start to arise.
Even most people that I know, they would, when they have a back injury, they would go after a chiropractor.
I would say going to a chiropractor is not wrong, but you have to go to a chiropractor who knows what he's doing. So if you have already a disc prolapse, and you have the symptoms of disc prolapse, and you go to a chiropractor and he does this aggressive manipulation, you could actually have more disc materials. And I did see some patients actually who became paralyzed post chiropractic manipulation. I remember we had to operate on one guy. But that's why really selecting whom to go to is very, very important.
Most people that I know, they would go to a chiropractor because they would have this scoliosis.
The scoliosis depends on what type of scoliosis.
Is it genetics?
There's many factors. If I could speak about scoliosis for 2 hours and I will not finish. But if I can focus, there is a curve that can be helped by the chiropractor, which is habitual. Like even myself, I went actually to a chiropractor once.
A habitual curve?
Yes, like the chiropractor, he examined me and he told me, you have more tense muscle this side. We need to release this muscle. And he told me, focus on your habits, on your daily, see what you do, why your body is not balanced. Because it's a mixture between lifestyle, genetics, and bad habits we have. If you go on the majlis all day sitting on one side like this, and your body is twisted, and this side will become tight. If you drive, and also you're leaning on one side, this will not be right. You know, your back should be balanced.
Your
should be
posture has to be straight.
They put that foot rest in the car for a reason. Actually, that's we use it so that our body is balanced. You know, if you here when you're working, there's many seats. This seat is not the best, by the way.
There is no back support in this one.
But it's very important to respect the spine curves and to appreciate it. If you respect your spine, the spine will respect you.
Okay, on a scale from 1 to 10, how hard is it to study and to take care of spine injuries?
It is very, very difficult, I would say, because there is a lot of not only science and disc, there's a lot of psychology associated. A lot of patients with back issues, they become depressed.
So you have to put yourself in the patient's place.
I already am in the patient's place, actually. I did experience back pain. I broke my back mountain biking
But you're a doctor.
a couple of years ago, and I did feel the pain of back. It's terrible pain, but it was the simplest fracture you could get, and I recovered. This is the beauty of cycling, by the way.
And did you trust the doctor?
If an injury happens, it's not life-threatening.
Yeah. And did you trust the doctor who did the surgery on you?
No, I didn't do surgery. Alhamdulillah, I did not need it. Like it was a simple fracture, you know. But I would say they say that doctors are worst patients. And I didn't listen to my colleague who was giving me advice. And 6 months later, after that injury, I did the Stelvio Passo with Ali ibn Adwar, your CEO. Like the highest mountain you could climb on a bike in Europe.
How many months later after the surgery?
6 months.
After the
After
injury.
a broken spine.
After a broken spine,
Yeah.
6 months, you
And
go.
I never advise my patients to do this, by the way. But they say doctors are worse patients.
6 months after you go climb a mountain. But was it pain?
On a bike.
Do you still feel the pain right
No,
now?
alhamdulillah, it healed. But and also I find that sports helped me, and that's what I keep saying to my patients. The more you relax, actually, when you have the injury, the more the muscle spasm will happen, the more pain you will feel. So the more active is the better. But patients usually when they have the pain, they give up. They stay in the bed and they don't want to move, which is actually the worst thing they could do.
I heard you're a horse rider.
Yes. This is it was an old hobby when I was a kid, but we adopted this actually during the COVID crisis. We had some extra time. We needed a new hobby, so.
And did it affect your back?
Yeah, horse riding I think is very good for the back when you're doing it the right way, the right technique, and you have the right horse, obviously. We don't want to have a crazy horse that will make you fall off the horse, but it's a very good hobby.
It's nice to leave the surgery room every once in a while. And
I actually fight to have different targets and goals. I did ultra marathons, I did endurance races. Last year I did 2 40K qualifiers on the horse, which takes around on average 3 hours, which it is truly a wonderful sport. You're in the middle of the desert and nature, and then you see the sunset, then the moon rises, and you're still on the horse, riding at night, and you feel united with your horse. There's so much joy, it is a painful sport, but when you finish the line, there's nothing beats that feeling.
it's you get this feeling of it's nice to leave the city every once in a while.
Yeah, definitely. You're in peace, you're total peace.
I've tried horseback riding and I always get back pain. I feel like my vertebrae are always compressed.
You have to strengthen your body before doing any sport. That's why, which is a mistake I did earlier. I did only cycling for years. But when I adopted going to the gym and doing general body strengthening, your body is strong and ready to do any sport without the risk of being injured. So it is very important that you strengthen your body and also do every sport in the proper technique.
Guys, don't overload the weights. You have to go progressive overload.
Exactly. You have to understand. We don't have enough knowledge and experience, to be honest. I think there is a lot of education that needs to be done about training load, about training techniques, because if you understand these things as an athlete, then you will avoid injury. If you haven't exercised in your life and you just decide one day I want to go and do paddle, you will end up in Aspetar in no time.
How many patients have you seen that come from paddle?
A lot, actually. We have decided, now I think it's becoming less, the paddle heat is reducing, but there was a time where every week we would see at least 5 patients.
It's always wrist problems.
They have tennis elbow, they have a lot of Achilles tendon rupture, back pain because of the twisting. So you really have to understand each sport and what it needs, and you work your body in order to strengthen yourself before committing and doing such sport.
I think most of the big problem is most of the guys, like when you play football and when you play paddle, it's an explosive sport.
Exactly, it's a high intensity.
So you have to focus on different types of workouts, not the conventional weightlifting. And
definitely,
I think that's the main issue.
Definitely, each sport will require certain skills and certain muscles, but I think doing resistance training is extremely important. Focusing on your core and back is extremely important. Having good flexibility is crucial for your back, for your shoulders, for all your joints and all your body.
So as much as we work out lifting weights, we have to focus on the flexibility and mobility as well.
Definitely.
So Dr. Abdulaziz, I've been seeing these videos on TikTok, even like the other social media platforms, of surgeries, knee surgeries in particular.
Yes.
Where the doctor is holding a bat or something and he's just hammering. the knee.
I have to admit we use crazy stuff. You know?
And
We use saws, we use screws.
Do you enjoy doing this?
Do you enjoy doing this interview?
Yes, of course.
Same thing for me. I enjoy my job, and this is the reconstructive part of it that I love the most.
Smashing a rod inside the knee, you call this reconstruction?
Exactly, because there is a broken bone, and this rod will make the
Will replace
patient.
the broken bone.
Yeah, it will stabilize the bone, and the patient will be able to walk next day. Definitely, you're doing something good for the patient. But obviously, we don't tell this to the patient. We're going to use the hammer. But you know what? Now we actually started using spinal anesthesia.
Spinal anesthesia.
Yeah, which is like the patient is awake, but he's not feeling from the waist down, which is actually a good option.
Does he see everything?
We use a curtain, but he listens.
That's worse.
So he could listen. That's why they give him sedation. But sometimes we used to do some surgery, and the patient is chatting with you. If he's brave, he can. Or you could actually do some arthroscopy, and he could look at the screen, and you explain to him what you're doing. I wouldn't do that, If it was me, I ask for sedation.
Do you give him like an option? You can see me on screen.
Definitely, you have to. I mean, if it was myself, I wouldn't do it.
I'd rather go to sleep.
I would go to sleep as well.
Yeah.
But strangely enough, some patients, they ask to stay awake and they want to see the procedures.
That's different level.
Yeah.
That's different. And Dr. Abdulaziz, I want to know, what type of tools do you guys use, especially with the advancement of technology?
Definitely, I would say our life now is much, much easier than 10 years ago. There was advances in every field. As you can see, your phone now can do almost everything. And the same thing in medicine, we had advances in many aspects. There is advances in navigation, how we navigate the spine. We know exactly where we are. By this, you reduce the margin of error because you work with very sensitive structures. So it's very important to know where you are. The imaging quality has improved significantly to make our life easier and our job safer. The tools we use, like there is an ultrasonic
saw machine.
For instance, it's like a small blade. It's not really moving. There's a micro oscillation that doesn't see and cuts through the bone. And when the bone finishes, it stops. So obviously, if I'm working on the spine, under the spine is the spinal cord. So that machine would oscillate, and it stops automatically after cutting the bone. Sometimes you have to remove part of the bone in order to decompress the spine. So by using this, our job is much easier and much safer. And also at the same time, it coagulates. So it cuts and coagulates, so it doesn't allow for bleeding to happen.
So it does everything basically. Most of the stuff.
You have to control your hand, obviously, and not just push it. But it doesn't. There is actually a robotic surgery in the horizon, but still, I think it sways in spine.
So you can do a surgery in Doha for a patient in the US.
We did not reach that level.
Still.
No, but I think in general surgery you could, because of this robotic arms inside the abdomen. And spine, the robotic surgery we have is actually just to allow you, to prevent you from doing the error. So you use the navigation or the combination of the robotic surgery to, like if I moved my hand in a wrong direction, it will not allow me. This was the use of robotic surgery. It's not a strong. Up till now, did not really prove the importance or the efficiency of it.
So do you think technology definitely played a big role in the advancement?
Definitely. I think most of the surgeons now are lucky to operate in this era because, as I said, technology have helped us and made our job much easier and safer. And
do you see any upcoming advancement, like tools and stuff?
Yeah, every conference we go to, there is new products and new procedures, and there are some old procedures that have been abandoned for a low quality. I can give an example of artificial disc replacement. Like when I did my fellowship, we are doing them, a huge number of them. Suddenly,
what's an artificial disc replacement?
so there's two types when we operate on the spine. There's the fusion surgery, where we put the screws and we put a cage inside the disc space, so that the bone grows and the spine fuses. So that those two vertebrae, they become like one unit. The other option is to put an artificial disc. So the artificial disc, there's the advantage of having the mobility, but the mobility is not always an advantage, because some cases you have to really fuse the spine, because if you don't, the patient will continue to struggle with. The cervical disc has proven its success and continued, but for the lumbar disc, it was stopped because there was a lot of complications, long-term complications. Now, actually, it's becoming again in the market. There's a new device that, the surgeons who are doing it claim that it's safe and it's good, but still we have to see the long-term results for it.
And how do you keep up with these new tools? Like, do you get them and they tell you, like, is there like a manual guide you have to read?
No, but every conference, every big conference you go to, you will see all this technology. And so there are few conferences that are the landmarks for spine or for joint replacement. So you have to make sure that you attend all those conferences to keep updated.
And then they will get someone who sets you on this tool.
The representative, there is usually the companies here, they have a representative. And if we decide to adopt a new method, we go on courses to train, and then we apply.
So you see like a big future?
Yeah, definitely. There's always, in medicine, there's always innovations in every specialty.
And how do you continue to keep updating yourself and learning more about the field?
The conferences that you attend, reading the different medical journals, staying updated with your network of colleagues. Like, for instance, I'm the education officer for the AO Spine, which is a spine organization. So being part of those different medical organizations also keep you updated and keep you in the loop for any new advances.
So, Dr. Abdulaziz, you have these upcoming students who think of becoming like surgeons.
Yes.
But they back off because you have to constantly update yourself and read. They have this thing that you have to read and
I think
more.
Regardless of your specialty or of your career, you have to always read and improve yourself. If you're an auditor, you will find the auditors going to attend conferences and audit and taking workshops and updating themselves. If you're an engineer, same thing. So there is no career that you will sit and not improve yourself. If you sit and not improve yourself, you will go nowhere.
What advice would you give the younger generation?
Don't become doctors. No, I'm joking. I think it's very important to study and before committing yourself to a career, to really examine your interest, and don't go for something depending on somebody else's advice. Always, if you want to become a doctor, for instance, go and do some observership, some shadowing, live the life of a physician or an engineer or whatever before you commit and study and plan your. So if you're around the age of 14, 15, I think this is the time where maybe doing observership or shadowing positions in different careers is a good idea, so that you can decide what you want to do.
So, Dr. Abdulaziz, it was a pleasure to have you on the podcast.
And the pleasure is mine.
I'm happy to interview you and not see you at the hospital. That's a relief.
I hope not to see you there as well.
And guys, thank you for tuning in at the Late Night Podcast by Q+. Don't forget to follow us on our social media handles, and we'll see you at the next episode. Okay.